pagod to
Sa
ha.
bangko eh.
Nakaanin
Sa
na.
bangko meron yan.
Hello!
Sino yan? Si June.
Ayan, hindi. Hi, Doc! Hello po, good morning. Pasok po kayo.
Salamat.
Hello po. Andito po tayo, Doc.
Thank you, thank you.
Dito na tayo.
Ayan daw, saan na tayo?
Okay.
Sa sala.
Okay, good one.
Welcome
Saan
to
po?
our house,
Sige po,
Doc. Si Doc Philip
Tan-Gatue po. Don't
Tan-Gatue.
worry.
Gatwe.
Nobody gets it right the first time.
Tan-Gatue. Absuelto kami. Have a seat. Have a seat.
Okay, thank you.
Dok, tanong namin, no, alam namin pumunta ka dito dahil sa isang very special na topic. No, yung mga alternative medicine or cures for Crohn's disease.
Yes, men
Ano
basta-
po ba yung Crohn's disease muna? Kasi
Well,
yung mga kasambahay natin, minsan hindi nila alam yung...
Hindi familiar.
Hindi familiar sa disease na yun.
Yes, it's not one of those common things kasi actually mas common siya sa mga Europeans tsaka sa mga heavy industrialized. Kaya lang, mas nagiging common siya sa mga developing countries. Partly because yung diet natin, tsaka actually one of the side effects ng oral contraception yun. Pero very rare sa Filipino. Pero ang tanong nyo, ano po yung Crohn's disease? First of all, I'm not the ultimate expert on Crohn's disease kasi Crohn's disease is generally a problem for gastroenterologists. It's a problem under the umbrella of what we call irritable bowel syndrome. So, basically, maraming klaseng irritable bowel syndrome.
So, ibig sabihin nag-LBM, loose bowel movement, pag sinabi mo nga.
That's the most common one. So, paliwanag ko lang yung isang pasyente ko. Taga-Europe siya, ilang taon siya natira sa China, so medyo iba yung pagkain doon. Pagdating niya dito, first time niya napunta sa China, nag-adjust yung bituka niya. Naku po, bloating, pagtatae, masakit ang tiyan, gas. Tapos, iba, hindi lang po pagtatae. Minsan, paglabas ng dumi, may nararamdaman na parang, not blood. That's more ulcerative colitis. Ang description ng pagtatae ng Crohn's is, para siyang lugaw.
Okay.
Now, the important thing about Crohn's disease is they're not quite sure what's causing it. The old days, which means nung nag-aaral pa ako, the theory is it's caused by autoimmune. That's the old theory. Currently, there's a mix of theories. One theory is it's multifactorial. So it's partly genetic. Partly genetics. Ayan, sa screen.
Okay.
Ulcerative colitis and Crohn's disease are similar. Iba lang yung presentation niya, tsaka iba yung treatment niya. It's partly genetic. You respond to the environment.
So, predisposed yung mga Caucasian.
Yes. And then, if you have a brother or sister who has Crohn's disease, you are 30 times more likely to have it compared to, let's say, yung walang kamag-anak na meron.
Walang connection.
Yes. So, and also, it's not just sa tiyan. It's not just in the most common area is dun sa dulon-dulon ng intestine.
Sa may colon na, sa may
To
large
be precise, yung dulo ng colon. But that's the most common. In fact, Crohn's disease can affect anywhere along the digestive tract. It's named after an American doctor who first described it in the 1930s. In fact, yung iba, meron mga parang singaw.
Ah, really?
Yes. Up to ulcers, yung technical term na.
Tanong ko lang din ba, yung halimbawa meron kang food allergy na lagi mong kinakain na parang feeling mo pag lagi mong kakainin, magiging immune ka na, does it also affect your stomach na mag-develop siya ng Crohn's disease? Kasi nagkakaroon ng sugat yung...
Not quite. They're not quite the same. You're talking more of autoimmune. Ganun. Ito naman, it's more related to the fact na ang ating bituka has a natural environment na puro maraming mikrobyo. So the current theory is that your own stomach normally may kinakalaban siyang mikrobyo. Eh ngayon, dahil sa marami tayong kinakain, antibiotic, underactive yung ating immune system na what we call innate.
Okay.
Because we actually have two kinds of immune system. Yung innate, parang security guard siya, na in general titingnan niya kung sino yung dumadaan. The other one is called adaptive. Yun yung mga parang binigyan na tayo ng wanted poster. Ito, hanapin mo. Ito, hanapin mo. So, the theory now is mahina yung innate, yung adaptive naman, bumabawi. So, hyperactivity of one compensating for the lack of another.
The
So
other.
this is actually incurable, both in Western and Chinese. But the trick
Could
is...
it be fatal?
Complications,
Does it get
yes.
worse?
Dahil
Diba?
dehydration, etc.
Among other things, dehydration, it could lead to further infection. Kung talagang... Kasi ang nangyayari, parang nagsislow off yung mucosa eh. Also, if this happens to children, mas siya, hindi maganda because their absorption of B vitamins is weakened. Therefore, they have poor growth, poor development.
So ano yung pwedeng gawin alternatively, no, dun sa mga pag sinabi bang alternative, may halo na to ng Eastern medicine, no, hindi lang parang Western
Linawin
medicine.
lang po natin kasi the term alternative is very relative.
Yeah, oo
Kasi what is mainstream 150 years ago is quackery now.
Okay.
Mga 200, 150 years ago, standard Western medical care is paduguin.
Yeah.
You know, and we're not just talking 1 or 2 drops. We're talking whole balde.
Oo, balde.
Ng
Or
dugo.
planggana.
Planggana ng dugo. So, that's not standard now. And then also, what is standard for one culture might be alternative for another. So, I'd like to cite a study.
Okay.
In fact, I was invited here kasi may nakabasa nung blog ko where it's acupuncture.net.ph where I like to talk about different studies na talking about acupuncture and Chinese herbs. They took 92 patients, all suffering from Crohn's disease, and then they divided it into 2 groups, di ba? Kasi scientists po tayo, hindi tayo basta-basta umasa sa mga anecdotes lang o testimonial na gumaling ako. Hindi, kailangan may science
May
tayo.
study.
The study divided the 92 people into 2 basic groups. Both groups actually got acupuncture and moxibustion, may sinusunog na herbs. But the difference is, dun sa control group, yung ginawa nila ng fake, nilagay nila yung acupuncture point, nilagay nila yung acupuncture needle sa pecking point. Hindi dun sa tunay na point.
Na point.
Tapos, ang galing nga nila, pati yung sinusunog na herbs na moxibustion, pineke nila.
Okay.
Ginawa nilang wheat bran. So, pag sinunog mo, halos pareho yung amoy, pero nasusunog rin na mabagal. Katulad nung Chinese herb na pag sinunog mo to provide some heat. Okay? So, yun yung dalawang group. So, both of them think they're getting the real thing. Hindi lang siya double blind kasi yung nagtutusok dun sa fake point, alam niya na tinutusok na yung fake point. Now, the result is both groups generally felt improvement. So, partly, aminin natin, meron siyang
Psychosomatic. Yeah.
Oo. But, if you compare the degree of improvement, ang laki ng difference.
Dun sa
Experimental.
experimental.
And this is not just yung, uy, kamusta pakiramdam mo? They actually took blood samples and stool samples to see kung may pagbabago
Yung mga
dun sa
lab
mga
tests.
inflammation. Kasi this is a chronic inflammatory disease. So, ganun
So,
po
ang
yan.
sinasabi mo, Doc, acupuncture can actually be an alternative cure for those with this kind of disease, Crohn's disease.
Because the alternative is a lot of antibiotics.
Okay.
And some people don't like that. Or maybe some people, meron sakit sa bato, ayaw mo bigyan ng maraming oral. You want something that can help control and not necessarily cure. Like I said, Crohn's disease has no cure. But we can... The secret to managing Crohn's disease is... Kasi pabalik-balik yan eh. May panahon na okay, may panahon na hindi okay. Gusto mo, mas madalas yung panahon na okay kaysa hindi.
So, Doc, saan parte ng katawan usually tinutusok yung needles? Kasi di ba may mga may mga pressure points, acupuncture points na that would correspond to the intestines, etc.
Well, in the study, you're absolutely correct. In the study, they used a mixture. They don't use the same points for all patients kasi syempre, depende rin sa presentation kung ano yung lumalabas. Meron kasi iba, mas brutal yung pagtatae. Meron iba, mas prevalent yung
Moderate.
gas and pain. But the most common ones would be a point here near the abdomen, near the belly button, malapit sa umbilicus, tawag namin. And there are some points na for digestion talaga dito sa below the knee. For those na in the audience na may be familiar, they want to look it up, stomach 25, stomach 36, 37. These are the WHO standard numbering for points. Kasi they're Chinese names, like Susan Lee, pero mas madali tandaan, stomach 36.
Ganon.
So, different siya sa traditional na acupuncture. Kasi I've tried na yung traditional. Yung buong katawan mo talaga is lalagyan nila ng needles.
But here's the thing also
Meron iba, parang may sa kamay lang, meron ng dalawa, tatlong needles, di ba?
Acupuncture is like martial arts. Marami siyang style. For example,
Depende sa doctor din.
and it also, even within styles, it depends on the personal preference or the personal style. For example, ako, I'm heavily influenced by yung naging professor ko sa China. Some people naman are heavily influenced by other... I try to pick up things from everyone that I work and study with. Pero my biggest influence siguro sa akin is, like you said, keep the number of needles down.
As much as possible.
That's my style.
Yeah.
So,
Hindi
walang-
paramihan.
Di ba, walang
Paramihan,
effect yung
yeah.
size, yung weight ng isang tao sa dami ng needles na
dami.
ilalagay.
I can say siguro na... Well, to quote one of my professors in Beijing, it's actually... He noticed that it's mostly race. For example, the ones who tend to use a lot of needles, we're talking about acupuncture, Koreans tend to use a lot of needles kasi I'm sure if you've tried it, paglagay mo ng karayom, may parang bumibigat, di ba? Mas mahirap i-elicit yung feeling na yun sa mga among Koreans.
Okay.
That's why
yung pain tolerance sila siguro mataas.
That's why as a culture, they use more
Marami.
needles, mas aggressive sila mga likod. Japanese naman, konting tusok mo lang, ang lakas na ng epekto.
effect.
So their particular style of acupuncture,
Less is more.
less needles, and don't let them feel anything. Konting ganun lang.
Yeah.
So there's so
Parang
many
kagat lang
different styles.
Doc, para sa mga gustong magpa-acupuncture, ano pong kailangang parang safety tips para malaman na yung pupuntahan nila ay well-trained
Legit,
tsaka well-certified?
Well, dito sa Pilipinas, there is still no licensure, unlike in the United States and China. In China, those who practice acupuncture are mostly doctors of Oriental medicine. In the United States, they may or may not be medical doctors. But here in the Philippines, they also may or may not be medical doctors. But if I were to, since you were asking about what is the governing body or what is the predominant society, we have a society called the Philippine Association of Acupuncture Incorporated. Dinagdag din ng incorporated kasi pag Philippine Association of Academy of Acupuncture, yung abbreviation medyo bitin.
Okay.
You know what I mean? Let's not get to that. And then we have certification. Now, before they give you the certification, you have a minimum number of hours of training. You have a minimum number of patients na kailangan na handle mo under supervision. And then, you're given a certification either as a medical acupuncturist, a title that I'm not comfortable with. But I mean, I'm admitting this. Everyone knows this naman. And certified acupuncturist.
Attorney, if I
So-
may ask lang kay Doctor,
Yes.
no, regarding po dun sa sinasabi sa mga trainings. So the society itself holds the training, tama po ba?
There are various training programs which are all which have to be accredited by the society. It's not yet a licensure like PRC, so you can't go after but at least you know na
Yung standards.
There are
The
standards.
ethical
At
standards
least
of the
merong
society itself.
yes.
Guide.
Yung
And
nag-regulate,
also,
diba?
this society is under the Philippine Institute for Traditional Alternative Healthcare, which is a government-owned and controlled corporation.
JOCC.
Yes. Formed under the Republic Act 8423, the Traditional Alternative Medicine Act of 1997. So anything to do with traditional and alternative medicine goes under PITAC, Philippine Institute for Traditional and Alternative Healthcare.
Ayan, maraming salamat kay
Dr. Philip Tan-Gatue.
Tan-Gatue.
Ayan. Kuha ko na second time around.
Oo nga.
Maraming salamat. At saan kayo matatagpuan pala, Doktor?
I'm a clinical associate professor at the Department of Family and Community Medicine at the University of the Philippines College of Medicine. So I have private practice in the Faculty Medical Arts Building. I also
UPPGH.
UPPGH. I also am consultant director of acupuncture services in the Medical City in Pasig. So
may clinic rin kayo sa Medical City?
yes, actually that's the fun part. Marami na siya, mga clinics inside so-called Western medicine hospitals.
Oh, wow.
And we're not just talking about individual practitioners practicing. We're talking about part siya of the services offered by the hospital.
I didn't know that.
What's yung,
Oh, I didn't know that.
Naming names, St. Luke's has their Center for Complementary Medicine. See, I'm promoting them. They're my friends also naman. East Avenue Medical Center has a Center for Oriental Medicine. Others that off the top of my head, Amang Rodriguez also has. Of course, PGH, my forever home.
Doc, telephone number? Meron?
For PGH, you can ask the 708-0000 local 160. The others, di ko memorya na masyado. Madali yung PGH.
Sige.
But I can also be found in my website and blog, acupuncture.net.ph.
Acupuncture.net.ph.
Yung .com.ph, iba yun. Pero
Iba yun.
kaibigan ko rin yung
Sige.
may-ari.
.net.ph si Doc.
Or you can just
Tan-Gatue.
Or you can just Google my name. I have a Facebook page also.
Alright. Maraming salamat again, Dr. Philip Tan-Gatue,
Yes,
sa inyong pagbisita dito sa amin sa bahay. Thank you.
very much.